Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're looking at Ehlers-Danlos syndrome, or EDS, a group of inherited connective tissue conditions. They affect the body's collagen, which is like the glue and support that holds tissues together. Because of that, patients may have very flexible joints, stretchy or fragile skin, and a tendency to bruise or injure easily. But Ehlers-Danlos syndrome can also affect the heart, the blood vessels, the digestive system, and more. So we're going to unpack this and we're going to see what this EDS is, how doctors diagnose it, and what treatment options exist. Today, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine, is here to explain.
Well, thank you. It's a privilege to be here.
All right. What exactly is Ehlers-Danlos syndrome?
Ehlers-Danlos syndrome is not just one condition. It's a group of related disorders caused by problems in connective tissue. There are 13 main types, and the most common is hypermobile type, where the patients have loose joints, frequent sprains, and dislocations, often with chronic pain. Other types affect the skin with scarring and fragility, or in vascular type can make our blood vessels more likely to rupturing. I might add that they nearly all come in and say, I have, and then they'll say, loose joints. They nearly always know something's wrong with them. They say they're triple jointed.
Oh, okay. So are people born with it?
Yes, ma'am. EDS is inherited, meaning it runs in families. It's caused by changes in the body's connective tissue, which forms during early development. Since connective tissue makes up skin, joints, ligaments, and even blood vessels, the effects can be wide-ranging. Some patients notice symptoms in childhood, like being double jointed or easily bruised, while others are not diagnosed until adulthood.
What does traditional Chinese medicine say?
Traditional Chinese medicine approaches EDS as an imbalance in the systems that support bones, joints, and blood flow. Weakness of energy, a key, is thought to cause the joint instability and poor healing, while circulation problems may lead to bruising and fatigue. Treatment here may use acupuncture, herbal strategies, and lifestyle, always with careful adaptation for tissue fragility.
How do you diagnose Ehlers-Danlos syndrome?
Diagnosis begins with a careful physical exam and patient history. Doctors look for signs like extra flexible joints, stretchy skin, unusual scarring, frequent dislocations, and family history. For the most types, diagnosis is confirmed with genetic testing, but for the hypermobile type, most common, there's no single genetic test, so doctors rely on clinical criteria. This usually includes scoring the flexible joints and identifying typical features, ruling out other conditions, and screening the heart, blood vessels, and imaging. Unfortunately, many patients experience long delays in diagnosis, sometimes up to a decade.
I can almost hear the audience be kind of frightened about the heart. So you're telling our audience that heart and blood vessels are affected with what, loosening?
Sure. The connective tissue surrounding the vessels going in and out of the heart have conditions that are flexible. And so they're not as taut.
Mm-hmm.
And fortunately, most of the times we can catch it. But look at these long delays, sometimes up to a decade. Holy moly.
All right. So conventional treatments, standard of care?
Well, there's no cure, but treatments focus on managing the symptoms and protecting the joints. Physical therapy to strengthen the muscles and improve stability there. And this one we use all the time, bracing and taping for weak joints. So the main management of these are not just medications, but massage and pacing activities. We often write letters to their employers. Precautions in surgery or dental work because tissue fragility increases risk of bleeding, poor wound healing, and resistance in anesthetics. Support for autonomic symptoms like dizziness or fainting with fluid, salt, and compression stockings also help.
All right. So, what about your regenerative medicine? What are you doing for EDS?
Well, there are, in fact, regenerative therapies that are being used, studied, and have supportive therapies. Regenerative cells aimed at improving tissue repair and reducing inflammation help. The prolotherapy I personally used in a number of those patients in our office. And what that does is it injects natural substances that are already in our bodies, dextrose and others, to strengthen the loose ligaments and improve joint stability. Another good option is PRP, which is platelet-rich plasma, injections using the patient's own platelets to release growth factors, healing factors, and help strengthen the tendons and joints. Exosomes, the signaling vessels from regenerative cells, studied for their potential to reduce inflammation and improve tissue resilience. These are not cures, but for some patients, they may reduce pain and stability, especially when combined with other therapies and bracing.
All right. So, what lifestyle strategies should a person that has this get it into their head that they've got to change?
No question. Lifestyle is central to living. Most of the time, it does take exactly what you said, Dr. PENSANTI. They've got to get it in their head. Low impact options like swimming, cycling, even Pilates with a focus on strengthening posture is good as long as it's not done to excess. The joint protection, we use a lot of braces and compression clothing to avoid extreme stretch, and energy pacing, balancing rest with activities. In fact, often we have them taking a break, get up, use the restroom or something every 30 minutes to avoid fatigue and flare-ups. Nutrition, a balanced diet with enough fiber and hydration to support digestion, is often affected. Sleep and stress management, of course, lend to the need for proper rest, supportive mattresses, relaxation techniques to reduce the pain and improve the resilience. Mental health support, counseling, peer groups, and validation are all important since patients often feel misunderstood.
And their long term outlook?
I think it's chronic and lifelong, but severity varies tremendously. Some people have mild symptoms, but there's flares. You even see young men and women, more women actually in our office than men, but they're in their 20s and they've already had 2 or 3 dislocations, vascular fragility, and chronic pain. These hypermobile joints tend to cause long-term pain, fatigue, and instability, but it is not, or rarely, life-threatening. The vascular type is more dangerous due to the risk of the arterial rupture. With regular follow-up, though, and utilizing the supportive therapies, your lifestyle strategy could be improved. And with the support of the medical team, many patients can significantly improve their quality of life.
I know you have a mnemonic for it. What is it?
It's FLEX.
F stands for?
Fragile tissue, skin, vessels, and connective tissue.
L.
Loose joints with dislocations and pain.
E.
Every system may be involved: heart, gut, nerve, skin, all of them.
X.
Extra care needed in lifestyle, regenerative options, multidiscipline support, and I'd add counseling.
Well, thank you, Dr. Henderson, for taking us through Ehlers-Danlos syndrome, a condition that can be challenging and sometimes misunderstood, but one where awareness, support make a tremendous difference. If you or someone you know has very flexible joints, unusual scarring, or unexplained chronic pain, don't ignore it. Seek evaluation because early diagnosis, lifestyle strategies, and supportive treatments can greatly improve outcomes. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.